This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson alongside Sarah Giosi, helping you get the week started. Good morning, Sarah.
Good morning.
Why don't you introduce our guest in studio this morning? How about that?
Okay.
I always do it. I'm going to toss it to you today.
All right. Today we are speaking with oncology nurse practitioners for Mon Health Cancer Center. And I've got beside me, easy to remember, Sarah. And then we've got Jess. Good morning, ladies.
Good morning.
How are you guys doing?
Good. How are you doing? All right.
All right, good. We all got our vitamin D this weekend, so now we're ready to go here for our Mon Health Talk. So why don't we begin? We always like to start the first segment by letting people just get to know you a little bit. That's one of the beautiful things about Mon Health, right? Is that it's so personal.
Right.
So Sarah, why don't we start with you? How did you get to Mon Health? Where are you from? Give us kind of those.
Okay. Well, my name's Sarah Proffitt. I'm originally from Point Pleasant, West Virginia. I attended West Virginia University. That's how I ended up in Morgantown. I got my Bachelor's of Science in Nursing there and then went on to Wheeling Jesuit University for my Master's of Science in Nursing, and with an emphasis on family nurse practitioner. I've been a nurse for a little over 10 years. I've worked in the intensive care unit, home health, internal medicine. For the past 2 years, I've been working as a nurse practitioner in the specialty of GYN oncology.
Okay, very cool. Jess?
I'm originally from Morgantown. I also went to WVU for undergrad and grad school. I did some additional training in Pittsburgh for cancer genetics. I initially started in the ICU at WVU, and then I came over to Mon Health, and I've been in GYN oncology for the last 7 years.
All right, I love it. We've got some West Virginia girls, Dave.
Now, you got to be
I love
nice,
that.
though. This is an MHS grad over here.
Oh, all
right. She's a hawk.
All right.
She's a hawk.
We won't hold it against you.
You're outnumbered in here.
I know.
With my affiliation with, I do sports over at MHS, so we have a friendly rivalry, even though I'm not here.
All right.
So what, guys, what is the role of a nurse practitioner? What are you guys doing? Sarah?
We are doing a lot as far as we're directly involved in patient care. We coordinate a lot of the patient care that goes on, whether it be, getting a patient ready for surgery, caring for them after surgery, assisting in surgery. We also help develop care plans for patients that are coming in to receive chemotherapy. We work with the patients throughout the time that they're receiving chemotherapy, and then in follow-up, we also see them. And then we provide routine gynecologic care.
We round on patients through the hospital. We see patients every day while they're there, before surgery, after surgery.
Seems like, I was just going to say, you may spend as much time, maybe even more time with patients than doctors have 100 different things going on.
That's right.
You may be the primary go-between to build those relationships with these patients.
Sure. Yes, a lot of times we are. I mean, we're seeing, again, the physicians are always there, and
they're the ones kind of creating the master plan, if you will, and then we make sure that plan gets done in detail and work out all the little nitty-gritty things that are kind of going on in the background.
The patient care execution side of it.
Yeah.
So, and maybe then this is reiterating a little bit, but you clearly have very hands-on relationships with the patients.
Yes.
Talk to me a little bit about how you work with the actual oncology physicians then. What is that partnership like?
That is, so starting in the morning, we round with the docs on every patient that's on the floor of the hospital, create a plan with them. Sometimes they have ideas, we have ideas. We kind of, bounce things off of each other so that there are many heads thinking and coming up with
Which is great.
things for the patients. And then we assist the doctors directly in surgery. They can't do that alone. We don't have residents in the hospital that really assist in surgery for the most part. So we're the ones in surgery with them every day. And then in the clinic side, we see the follow-up patients with them, and sometimes when we're creating plans, we go in with them and create that plan at the bedside at their post-op visits.
Wow. It's amazing. It's a partnership.
It is.
Yes, for
And we're going to talk more about that partnership. And
Yeah.
specifically, we'll get into some of those individualized plans, how they're created, what types of treatment are available when it comes to cancer treatments at Mon Health Cancer Center. Joining us in studio this morning are oncology nurse practitioners Just Pforr and Sarah Proffitt. We'll continue the conversation next. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Dave Wilson and Sarah Giosi with you. Joining us in studio this morning are oncology nurse practitioners Just Pforr and Sarah Proffitt.
And Sarah, why don't we start with you this time? Let's talk a little bit about the types of treatments that are available at Mon Health Cancer Center.
Well, at Mon Health Cancer Center, you can receive numerous types of treatments and care. We have many service lines available in order to get your treatment. We offer surgery, we offer chemotherapy, and we offer radiation treatments as well, in addition to other complementary services.
So a little bit of everything.
Yes, a little bit of everything, and it's nice because you are in one system to receive all of your care.
Yeah.
Yeah.
And even though you're in one system, each person is going to need to have such individualized care. So Jessica, maybe you can address that one a little bit. Why is it important? Let's say Dave and I both come in and we both have the same situation going on, but we may need very different care. Can you just talk about that process?
When we meet our patients for the first time, we get a feel for where they're from, what they do, what's important to them. That's the most important thing, is what is important to you, because you both are going to have completely different goals in your life. Maybe it's kids, or maybe it's work, or whatever it is. So you have to be able to adjust a treatment plan to be able to fit somebody's lifestyle, what their goals are, and just understanding that you have to sometimes change things so that you can get through treatment, but also feel good doing that.
When you come up with the treatment plan, obviously there's the plan at the hospital, what the doctors will do, what you guys will be administering, the medications, that kind of treatment. But also, do you work on a plan that the patients can do at home by themselves to help them get through the treatments and give them a better shot of feeling better and trying to live as normal a life as possible as they go through this process?
Absolutely. We like to encourage self-efficacy for our patients. Receiving a cancer diagnosis is devastating. And we are with our patients from the time they're in the hospital, from the time they're receiving their surgery, undergoing treatments. We keep lines of communication open for when they're home. We give them ideas and tips to help manage their care once they get home if they do experience side effects from the surgery, the chemotherapy, the radiation.
So let's talk about side effects. What are some of those most frequently seen? First thing that comes to my mind is hair loss. Or, what are some of those side effects, and how do people deal with them?
Hair loss is I feel like it's the most feared side effect that we have all of women having treatment in our office. But that seems to be the most feared side effect. That's the one that they are most shaken up by. And
it's so visual. I think it's not just how you feel. Everyone can see it.
Everybody can see it, and it's very hard to hide. So, first of all, recognizing that is traumatic is the first step, and letting them know that it's going to be okay and that their hair's likely going to come back most of the time. And we also work closely with some people in town who can help them get wigs or do scalp treatments and just help them feel overall better while they're getting chemo.
Just Pforr and Sarah Proffitt, oncology nurse practitioners at Mon Health Cancer Center, joining us in studio this morning. How much of the treatment plan in your role is also being a cheerleader for that patient, reminding them that they can get through it? You can do this, providing that encouragement, because it's a long and tough road oftentimes.
Right, for sure. And then even that is a big part of our role as nurse practitioners, as providers, to help our patients through it. And even, after treatment, the not knowing is the cancer going to come back, or having new normals in life after receiving treatment. So that's actually a big piece of what we do.
I wanted to talk about this a little bit too whenever it comes to genetics, because we do talk about it, and we talk a lot on here about how a lot of things in life, keeping a healthy lifestyle going in general, diet and exercise, not smoking, those types of things. But genetics obviously can play a role too. What kind of genetic testing do you do? Or is that something that matters or is important in regards to the types of services you provide?
It absolutely matters in a lot of our cancers. Ovarian cancer, it can be genetically related. It can be passed through the family, and that is a component that you can't avoid. We test all of our patients who have had ovarian cancer for a genetic mutation because it can change their treatment later on. It also affects their family members.
Sure.
If they're found to have mutations, sometimes they have higher risks of other types of cancers, and we'll be able to tell them that. Not all cancers are genetically related. Some of them are not even familial. They're not even related in the family at all. Some of them are environmental. But we do like to know when our patients have mutations, because we may be able to change their chemo. We may be able to change their maintenance therapies. It just opens up a lot of doors for us. And it also allows us to give their family a good idea of what they're looking at. Screening-wise, we may be able to give them more screenings. We may be able to find cancers very early that we wouldn't be able to otherwise. It's just an entirely different path.
And it all goes back into kind of how we started this conversation, Sarah, that individualized plan. It's not a one-size-fits-all treatment.
Right.
For everybody is going to, if you come in, we're going to do this treatment based on these factors and try to, obviously get the best outcome at the end of the day that we possibly can. And that's that individualized personal treatment plan you're going to find at Mon Health.
Yeah.
All right. We have another segment to go. Why don't we squeeze in a break?
Yeah, I think we
and
should.
We will get into the importance of that personalized care and a holistic approach. We've heard that term a couple of times on this program. We will continue the conversation on the other side of this time out. Jess Pforr and Sarah Proffitt, oncology nurse practitioners at Mon Health Cancer Center, joining us in studio this morning. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now, 304-296-0041.
Welcome back to the program. Joining us in studio this morning, Jess Pforr and Sarah Proffitt, oncology nurse practitioners at Mon Health Cancer Center.
Yes, and so, we've been talking about all of the details about these various treatments and things, and as Dave mentioned before we went to break, one of those words we've used a lot on Mon Health Talk is holistic health. So, Jess, we'll start with you. Why don't you start by defining for us what that means, and then we'll talk about how that relates to you guys specifically.
That is incorporating more than just the medical side of treatment. It's easy to think of cancer and think of just somebody's chemotherapy or surgery, but there's or radiation. But there's so many more things that go into that. Things that they can be doing at home: diet, exercise, physical therapy, occupational therapy, nutrition, counseling, family services, financial services. There's just so many things that go into somebody's plan of care.
Can you help a patient? A lot of what we talk about is physical care today with treatments, but can you also help patients with the emotional side, getting them connected with other patients and support groups who can, everybody can say, oh, I know what you're going through. Well, unless you've gone through it, you probably, I'm certain you don't know what they're going through.
We can absolutely do that. We do offer support groups at Mon Health for patients that are former patients and current patients that are undergoing treatment. We also have had patients that have finished their treatment and then come back as volunteers, and then they are more than happy to speak with anybody who's undergoing the same sorts of treatments. We also refer out to providers in the community if it's something that we think needs looked at a little bit closer, or maybe some medication to help with.
Because we do know, even scientifically speaking, and we won't get into the details on this, but mindset plays a big role in keeping a positive, healthy, emotional, and mental side is so important. And I appreciated that you even mentioned financial, because I think one of those pieces is the stress that comes with not just making the appointments and feeling exhausted, but then there's this whole other side of it too, where you also have to figure out how to pay for these treatments. And so there's so much to take into consideration. And again, we look so much at the physical side or the hair loss, or we focus in on those things, but there's so much going on. So that holistic health is so, so important. How do people find out more about you guys?
You can find us on the Mon Health website. We have profiles. We have the contact information for the Cancer Center is on there.
And it talks about the different programs we have and offerings at Mon Health.
So if somebody's listening and they could use some of that support, that's one of those resources to go to find it without even making a phone call or anything.
Yes.
I do have one more question for each of you here. Personal question, sort of. Well, what drew you to oncology in particular? That seems like it'd be a very, very tough field, tough department to work in. So what drew you particularly to that department? They're both looking at each other. You go first.
It can most certainly be a very, very tough field to work in, but it can also be very rewarding. Some personal experiences have drawn me to the field of oncology, and it's very important for me to be able to help someone who, again, we talked about cancer being a devastating diagnosis for multiple reasons, financial, personal, emotional, and I enjoy the satisfaction of helping people through that
Jess?
time in their life.
I actually ended up in oncology by accident. It was complete fluke, and within about a week, I knew I loved it. I connected really well with the patients. I understood them, and I just felt like we were on the same page. And I really couldn't imagine doing anything different at this point. It was just a very happy accident.
Takes a special heart, though, definitely. I think that was the point you were making, Dave.
That's where I was going. Because, again, it seems like a very, very tough field where you, as nurse practitioners and the other nurses and the doctors involved, you got to be tough to work in that field. What's tougher, developing an individual plan or doing this show?
Well, yeah, I agree.
Of course, for more information, monhealth.com/cancer. Sarah Proffitt and Jess Pforr, oncology nurse practitioners, joining us in studio this morning. Guys, thank you very much for stopping by, and it wasn't that bad.
Thank you.
All right, coming up top of the hour, Sarah, we've got Fox News, local news, and then we'll get into the talk of the town. And once again, you don't have to go to Cleveland, Baltimore, D.C., Columbus. Pick your favorite big city to find the kind of treatment that you can find right here in your own backyard over at the Mon Health Cancer Center. Jess and Sarah both nodding in approval. Guys, thanks for coming in this morning. Appreciate it very much.
Thank you for having us.
All right, top of the hour news coming up. Talk of the Town is next. You've been listening to Mon Health Talk on WAJR.